Hi, everybody. I'm here to talk about part of Chapter 5, Applications of Classical Conditioning. So I want to talk briefly about three different types of therapeutic techniques that are done in clinical practice that are based directly out of studies of classical conditioning. First one I want to talk about is called graduated exposure, and this one is also called systematic desensitization. So usually this is used for clients with phobic, who are phobic, who have a um, who have a fear, an irrational fear of an object or a situation, right? So they get to a point where that fear is interrupting their life to the point where they can't function. Same thing with anxiety disorders like obsessive compulsive disorder or PTSD. So all these types of fear disorders of fear and anxiety are actually um, are um, able to be extinguished by graduated exposure. So it's kind of like the opposite of conditioning, right? It's counter conditioning. So conditioning is like, for example, John Watson, who was saying, who wanted to instill fear into baby Albert, whereas here we want to take the fear and extinguish it out of the person. So there are certain steps that therapists take to do this. So the patient will learn about different relaxation techniques like meditation, um, and then they're asked to rate their fear of certain situations. So in this case, if somebody's afraid of of spiders, then they would rate the level of fear, and then they go through each level in each situation, and they use the relaxation techniques that they have learned. And as they get to the highest level of anxiety, they've already been able to calm themselves to the point where they are not afraid of spiders or whatever the object is. This has a very high success rate. About 80 to 90% of people are the fear is extinguished. Takes about 6 to 8 different sessions. So of course that could go over 6 to 8 weeks, or whatever is decided. And there are some limitations to this. Besides the fact that it's successful, there are limitations. For example, it does not, when you say you can think about spiders crawling on you as one of the options, then that subjective, right? We don't really know what you're thinking about specifically, so that can be problematic. And also, we're treating the symptom, right? So this is kind of typical on the medical field. We treat the symptom instead of the cause. In this case, this particular technique is very effective, but again, we can't treat it for depression or for schizophrenia or some other mental disorder that's not actually learned from the environment. Okay, so it has to be learned from the environment. Another technique would be flooding, and this reminds me of when you say, "Oh yeah, how did you learn how to swim?" And the other person says, "Well, my dad threw me into a pool or into the lake, and I just learned on my own." Well, that's kind of an example of flooding. So it involves immediately exposing the client to stimulus. Okay, but instead of the lake or the swimming as an example, this actually, if you're afraid of spiders, this would actually be like putting you in a room with a bunch of spiders. Okay, so you would do that. Does it sound cruel and heartless? A little bit, but there is a very high rate of success, and it's very quick. Okay, so we're talking about in class. We've talked about the stimulus, conditioned stimulus, like the shock or a puff of air to the eye, making you blink. The more aggressive it is, painful or uncomfortable, faster it comes to you, the quicker you are to be conditioned or unconditioned in this case. Okay, so flooding, right? So for example, a researcher might take somebody out who's afraid of cars and take them driving around, just driving around, not even looking at a car, a picture of a car and then being around a car. Instead of the desensitization step, those steps that you would actually just sort of flood that person with, just bombard that person right away with what they're afraid of. And it's very, you know, it's not for everybody, right? And so a therapist has to be careful about what kind of patient they have, and of course their background and prior situations before they decide that this is might be a good therapy. And of course every therapist is not comfortable with this, but like I said, it does produce a quick a quick, I guess, extinction, right, of that fear. So flooding is another example of different types of therapeutic techniques. And the third one I want to talk about quickly is aversion therapy. So I know you read about this. This is when you introduce a noxious stimulus, something that's very undesirable, in association with an unwanted behavior. So, of course, so like this picture shows it, but it's kind of hard to read. So, for example, there are medications or pills that you can take, and alcoholics have to take, or drops in this case, drops of this medication that if they put into wine or some alcohol, that when they drink it, they feel nauseous. Okay, so they're gonna soon associate drinking alcohol with the feeling of nausea. Okay, other other studies have included such things as electric shock. Okay, so aversion therapies, we're trying to uncondition, okay, an unwanted behavior. And so in order to do that, this is probably the most aggressive type of therapy to be used, and not ethical, usually not what we would consider to be ethical, but it's been used in a wide variety of therapy and behavioral therapy in the past. And so I want to talk about a few of those aversion therapies. So, for example, I did talk about, so there's actually a drug that you can take if you are an alcoholic, that actually paralyzes you. So it doesn't just make you feel sick, it paralyzes you. And just think how scary that would be. So, there's some aversive, right? And these are some very serious therapies, and these you don't go to right away. These are things that are, down the road and last resorts, and very, very, not taken lightly. Okay. So, and also many times these are not ethical anymore. So therapists don't typically use many of these anymore. So let's see. Okay, so for example, if you bite your fingernails, you might, you know that if you bite your fingernails and there's that bitter tasting polish you can put on it, and then it's supposed to associate the bitter taste with biting your fingernails. And that's an example of aversion therapy. Okay. One of the problems here, though, is that anytime we are associating something negative, like a punishment, to a behavior, especially a learned behavior, it doesn't always fare well, meaning that the treatment is not always helpful, because the aggressiveness or pain of the treatment actually, supersedes whatever behavior is undesirable. So the person, the individual isn't able to associate the smoking with electric shock, whatever. They just feel electric shock, and that association never happens. So it has to be very carefully manipulated. And we'll talk a little bit more about that when we talk about operant conditioning and kind of the timing and the specifics as far as really conditioning someone's behavior, especially something like this with, that includes something like punishment. We have to be very careful. It doesn't work all the time. Okay. And so another another treatment in the past has been, or actually it's still happening, or actually considered to be to be effective, would be conversion therapy, where in the past we've had, when homosexuality was considered to be a mental disorder because it was actually in the DSM until like maybe the 90s, and then, or I'm sorry, the 70s, and then conversion therapy, though, which is, by the way, um, usually it's religiously affiliated, not all the time, but it's trying to, operating under the assumption that homosexuality is something you choose to be, that you can also choose not to be. But sometimes we need to be kind of quote unquote shocked out of that. And so we could change. So people who are homosexual can actually change, but they need some sort of aversion therapy. So anything from shocks to, to a lot of visuals that are, very disturbing visuals, things like that that are associated then with like any kind of homosexual type of behavior or expression. Um, of course, that implies that homosexuality is something that people can change, and typically, I mean, for all intents and purposes, we know that isn't necessarily the truth. So, conversion therapy, there's a lot of proponents of it, but of course, I believe that there's a lot more people who are against it. And so, I wanted to bring that up, though, because conversion therapy was still done in 2013. And who knows, it could still be done. At the very least, there's still people that believe that that's something that we could use as far as helping to cure homosexuality. So it's a very severe example of aversion therapy, but yet it is a real one. Okay. So the last thing that I want to leave with, and I'm not going to talk about it because I want to get more into it in class, is consumer behaviorism. So, of course, classical conditioning has a lot to do with advertising. So we're going to talk more about that in class. And that's all I have. So I will see you later.